Okay, so the first test we're going to do is Lachman's test for anterior stability. And for this one, I'm going to have my patient sitting or supine, and I'm going to make sure that her quads and hamstrings are relaxed. And for this one, I'm going to grab her femur and also the proximal posterior tibia and make sure her knee is relaxed at 30. And I'm going to stabilize the femur and then apply an anterior pull um, to the proximal tibia. And if there was some sort of forward movement of the tibia or no endpoint there, that could indicate a torn ACL. And so the next one we're going to do is the prone Lachman's test. So I'm going to have my patient flip over on her stomach. And for this one, I am going to flex the knee to 30 degrees, and then I'm going to palpate the anterior joint line on both sides of the patellar tendon. And I'm also going to put a downwards pressure on the posterior proximal tibia. And if there was a forward shift in the tibia, that could indicate an ACL sprain. And so the next one we're going to do is anterior drawer for anterior stability. And for this one, I'm going to have my patient sitting supine with her knee flexed to 90. And for this one, I have to stabilize her foot. So I'm going to go ahead and sit on it. And then I'm going to apply an anterior pull to her proximal tibia. And I'm going to have my hands placed around her proximal tibia here and pull anteriorly. And if there is a shift in the tibia forward too much or no endpoint, that could indicate an ACL tear. And so the next one we're going to do is the Lever's sign test. And for this one, I'm going to have my patient sitting supine again. And for this one, I'm going to place my hand underneath her calf, and then I'm going to apply a downwards pressure on her thigh, which should make her foot raise up. And if her foot didn't raise up during this test, that could indicate a torn ACL. And so the next one we're going to do is the lateral pivot maneuver test, which for this one, I'm going to have my patient sitting supine, and I'm going to hold my patient's heel in my hand while internally rotating the tibia. And I'm also going to put pressure along the lateral side of her knee with my thumb just behind the head of her fibula. And for this one, I'm going to make sure I internally rotate the tibia and then apply a valgus force while moving from full extension to 30 degrees of flexion. And so if there is any type of clunk that happens around that 20 to 40 degrees range of flexion, that could indicate some type of ACL sprain or anterior lateral rotary instability. And so for the last one we're going to do is the slalom test. And for this one, I'm going to have my patient side lying. And I need to do sit down. And for this one, I'm going to have her uninjured leg, which is her bottom leg, flexed at the hip and knee to 90 degrees. And then her injured leg, which is going to be her top leg, is going to be at full extension with her foot internally rotated. And I'm going to apply a valgus force to the top of her knee and at the bottom of her knee. And as I apply that valgus force, her her foot should slide forward and upwards like that. And if her foot does not slide up, that could indicate there's an ACL sprain or some type of anterior lateral rotary instability, and that could be because of the reduce of the patella between that 25 to 45 degrees of flexion range. And this test is also good because it helps to relax the hamstrings and it makes it easier to use on bigger and heavier athletes.